Good afternoon, everyone, and thank you for joining us today, April the 6th Media Advisory. I hope everyone who celebrated Easter enjoyed a safe and happy holiday weekend. And thank you again for celebrating apart this year. As difficult as it is, it's necessary, and your actions will help stop the spread of COVID-19 in our community. As usual, I'm welcoming Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. But we also have some special guests today that will speak to their areas of concern in our community. Dr. Doug Sider, the Public Health Services physician. Melissa Farrell, President St. Joseph's Healthcare Hamilton. Dr. Mark Soth, Chief of Medical Care, St. Joseph's Healthcare Hamilton. Rob McIsaac, President and CEO of Hamilton Health Sciences, and Dr. Sanjay Sharma, Site Chief of the ICU Intensive Care Unit, Hamilton Health Sciences. So thank you all for joining us this afternoon, and we'll be hearing from you a little bit later. I'm pleased to bring the news today that residents in Hamilton who are 60 years of age or older are eligible to book an appointment to receive a COVID-19 vaccine. Residents can access the provincial online booking portal found at hamilton.ca/vaccine booking. For those who do not have access to the internet or a computer, or do not have a valid Ontario Photo Health card, you can call the Public Health Services COVID-19 hotline at 905-974-9848 and press option 7 to book an appointment. I also want to remind folks that everyone over the age of 60 is eligible to receive a COVID-19 vaccine. There are community members who are 65, 70, 75, 80 who have not yet booked their vaccine appointment. I encourage everyone eligible to do so. It is the best way that we can get to some sense of normalcy in our broader community. We want everyone that is eligible to get the vaccine. And information around that, if you need assistance, can be had at our Public Health Services COVID-19 hotline, again at 905-974-9848, option 7. If you need help and assistance booking an appointment, or you still have outstanding questions, you can go to the hotline and they can help you there. Also, a reminder that everyone in our community, even those that have been vaccinated, must continue to follow public health measures until we have the vast majority of our population vaccinated. As of today, 18.7% of our eligible population have received a COVID-19 vaccine. Over 100,000 individuals have received the vaccine. 15,000 or so have received the double dose, and the balance are still awaiting that dose in upcoming weeks and months. As you know, we're experiencing a surge in COVID-19 cases, including the variants of concern, and we must all continue to do our part to protect our hospitals from being overwhelmed and to protect every person in the city from catching this virus that is much more contagious and potentially much more harmful. Thank you to everyone who continues to do your part by following our public health measures, and I know that Dr. Elizabeth or Paul will outline those measures again. You are making a difference, so please keep doing it. It's very, very important, especially now, given where we are with these variants in our community. On that note, I'm going to pass it over to our Emergency Operations Center Director, Paul Johnson. Paul?
Thanks very much, Mr. Mayor. And it's great to be able to share just a few things about ways that we are encouraging some activity. And again, when we are in the gray lockdown zone, we're encouraged to do as little as possible in terms of getting into places, particularly indoors with lots of people. And if we have to be in those spaces, to obviously take protections. But one of the things we are encouraging is exercise. And being outside and exercising is something that is not only allowed in the gray lockdown category, it's encouraged as long as you're doing it safely and as long as you are doing it with either yourself or very few other people. To support that, our recreation division has already opened up our courts for tennis and pickleball and basketball, so they're now open. And this coming week, we will open our first golf course at our Shadoke Golf Course facility. The Martin course will reopen on Thursday. This is a bit of a tradition we have at the City of Hamilton, opening it for the Thursday of the Masters, starting that golf tournament in Augusta, Georgia. So the Martin course will be open. Beddoe course and the Kings Forest Golf Course, they're going to open just a little later. We're still working on preparing those courses and getting our staffing in place. but we will have our golf courses ready for use by the public, a whole ton of safety measures in place. We had a tremendous year last year. Everybody found ways to get out and use those facilities safely. We encourage you to do that as well this year. We're also going to be getting our playing fields ready for activity. This won't happen until early May. And we'll continue to monitor the category and the restrictions here in Hamilton and provide some information to groups and clubs that will want to be using those sports fields in terms of how they can do so safely. And as I've mentioned a few times, we are planning for a full summer schedule of activities. There may be obviously some restrictions on numbers. There may be some things put in place from a safety protocol perspective, but we expect to provide lots of opportunities for people to recreate safely in our community outdoors this coming summer. In terms of outdoor activities, a reminder, community gardens are permitted to operate under appropriate health and safety guidelines. We have lots of information on our website about operating a community garden safely, and we encourage people to do that. The big things are, of course, keep that physical separation, keep the numbers down wherever possible, avoid sharing tools amongst people when you're there, but by all means, let's get out and start to garden. It's a great source of fresh, healthy food. And for community gardening organizations, a reminder that any organized events that might be about training or teaching people some techniques around community gardens, those would have to adhere to the community gathering sizes, which are currently restricted to 5 people and no more. And on the other side of what happens when people are doing things that they shouldn't be doing, we continue to respond through our bylaw officers to complaints from the community. And we did have a number of complaints in this last week from residential situations. These are mainly parties and gatherings that exceed the limits. And so we've responded to a number of those. A few commercial issues as well, including some businesses, a business in particular that opened after they needed to be closed. But the big one, and I'll talk about this in the context of where I started today, is we had to lay a lot of charges at the waterfalls, nothing to do with COVID-19, but a lot of people getting off the trails, going into areas they're not permitted. So as we encourage you to get out and get some exercise and get some fresh air over these coming months, we do remind people either visiting our waterfalls or residents of Hamilton that live close to them and are using them as well, do so safely, do so in the marked areas only. And that will take the pressure off our bylaw officers, but also take the pressure off our emergency services should you get into trouble for being in areas that are off limits. So now I'll pass things over to Dr. Richardson.
Thanks, Paul. So today, going to give you a brief update on our case numbers and talk a little bit about the vaccine rollout, of course, and then just come back and talk a little bit more about the cases. As you see, we've got several guests here today who are going to be making some very important information available to us. So today we sit at 13,503 cases, 119 increase from yesterday. These include 1,092 local screen positive variant cases, with of course as well our 15 confirmed B117 cases. So we're now sitting over the last 7 days at about 50% of our cases have a mutation or variant of concern. We have about 860 active cases overall, and we've had 323 deaths to date, with 1 new death today. We have a total of 48 local outbreaks, as you'll see on our website, with 3 new outbreaks today, 1 at St. Thomas More Catholic Secondary School, 1 at Dundurn Place, and 1 at Kelly's residence on Proctor Boulevard. Our weekly incidence per 100,000 is sitting at 121, with a weekly reproductive rate of 1.21. And of course, you can find out more details on our COVID-19 website with the new interactive tool there as well that you can look at, and the data in various ways. From a vaccine perspective, we're at 114,630 vaccines having been administered by the start of today. That's 19.3% of those eligible to get the vaccine that have received it so far. We're very happy that this morning the province was able to decrease the threshold for us to age groups that are 60 years of age and older within the city of Hamilton. And of course, you can book an appointment through the booking portal that you'll find at www.hamilton.ca/vaccine booking. And there you can schedule an appointment at any one of the large-scale vaccination clinics, First Ontario Centre, St. Joe's West 5th Clinic, or Hamilton Health Sciences. And reminder again that those are all by appointment only clinics. For those who do not have access to the internet or to a computer, you can call into the Public Health Services COVID-19 hotline at 905-974-9848, option 7, to book an appointment. And those who do not have a valid Ontario Photo Health card can call in through that number as well. So very encouraged to move forward with that today. Of course, you'll also have heard from the province just earlier this afternoon announcing the beginning of the transition into phase 2. And we have been working with our Hamilton Healthcare partners, including Hamilton Health Sciences and St. Joe's here today, about the sequencing of phase 2 locally. So part of that rollout is into hotspot areas to increase vaccine uptakes in those communities that are disproportionately impacted by COVID-19. The province has announced 2 areas of Hamilton that will be included in the provincial booking tool shortly, and people in these areas who are age 50 and up will be eligible to be vaccinated. We have shared our data as well on terms of other hotspot communities in Hamilton and are working with the province to look to have them entered into the booking tool over the coming days. Using that booking tool is a very important route for us as we find that's the most easily accessible and for people to get in quickly. But again, working through the hotline will also be a route for people. We're also planning in these areas to do pop-up clinics to make sure that vaccine is as accessible as possible in these hotspot areas. We've been in many of them already as we've been working through the age groups to date, and we'll continue to work through those areas so that people have as much ability to get vaccinated as possible. So this is putting us a little closer to the light at the end of the tunnel. I'm pleased to know that as well, there's going to be additional vaccine supply on its way for us as a hotspot community to ensure that more people in our community can be vaccinated. So while that is very good news, there is, of course, I can't call it a wake-up call, it's an ongoing wake-up call about the fact of where we sit in the 3rd wave of COVID-19, with case numbers and outbreaks continuing to increase in Hamilton, along with a growing number of cases screening positive for the variants, a growing number of people in hospital, and a growing number of people in our ICUs. It's absolutely essential that we work together as a community to stop the spread of COVID-19 and the spread of our variants of concern. These do spread faster than the previous variant and carry a greater risk of severe disease and death. Our partners here today are going to be talking about the challenges that are facing our communities, hospitals, and our ICUs, and the overall capacity of our health system. It's a critical conversation that our community needs to have. It's important that, that we see the reality of what is facing us as this spread continues. So while our vaccine program does continue to expand, we need to continue to focus on limiting the spread of COVID-19. I talked a couple of weeks ago about what we saw in wave 2, that moving locally to gray was not sufficient to stop the spread and bring the numbers down, nor was the province-wide lockdown, which was stricter than what we had today. So that's the lockdown that was done in December. It wasn't until we went into a province-wide stay-at-home order that the numbers really did come down. And so I said a couple of weeks ago, and I'll say it again, our evidence shows that stricter measures are necessary to stem the transmission of this virus and gain control over the 3rd wave of the pandemic. You'll see similar calls that are coming from my colleagues in Peel, in Toronto, in Ottawa. These calls are coming from the Ontario Hospital Association, the Ontario Medical Association, the Registered Nurses Association of Ontario, and the Children's Health Coalition. So very important steps that need to be taken as we go forward. So at this point, I'm going to turn it over to Dr. Sider, who's going to show us some information from the modeling that we have been working on. Doug, over to you.
Thanks, Elizabeth. Let me pull up the slides that I want to show today for this media briefing. Good afternoon, everyone. I'd like to talk for the first time to the community about some work that a partnership of Hamilton Public Health Services, the St. Joe's Healthcare Hamilton, Hamilton Health Sciences, and the Hamilton Health Team have been engaged in with the Scarzin Corporation, where over the past 6 weeks, we've been working with them and their robust forecast modeling system, which they've labeled their decision support system. Now, the decision support system aids local decision-making and how best to minimize COVID-19 infections, hospitalizations, and deaths via public health measures, vaccination, policy measures, and more. Now, it's challenging to introduce modeling, forecasting in a short period of time. So I hope people bear with me. And this is going to be a fairly high level description, but part of what gets built into modeling are what are called key assumptions that underpin how you develop the model, how you develop the forecast, what the coming weeks and months look like. So the key assumptions that have gone into the model that I'm going to show you in a moment are that obviously the current provincial lockdown is in place. It will be in effect for 28 days. But at this point in time, we are assuming that there will be no additional measures, such as has been referred to by Dr. Richardson. As well as has been mentioned, the model has built in the reality of the growing problem with COVID-19 variants of concern, especially the fact that they are more transmissible, they lead to more serious disease and hospitalizations, and they cause more deaths. The assumptions also include that the vaccine supply continues to support Hamilton's vaccination rollout. And finally, a key assumption, because there certainly has been lots of discussion about this, and you've seen the directions that other medical officers of health have chosen in other communities, that the assumption underpinning the model is that the schools across Hamilton will remain open after the spring break. So let's have a look at the model, the current model, and it's a little bit, probably this is the first time visually a lot of people are looking at this, and I want to explain a few features of the model. So this goes back to September. The blue, the jagged line are the daily reported cases that occurred from September up until the current date. The blue bars are the smoothed 7-day average of the newly reported cases. So you can see what wave 2 was like. We had what we call little peaklets, but we got up to a point just around the end of December where we had our maximum number of new daily reported cases, a bit over 130 cases. And around this point in time here, as Dr. Richardson referred to, the province instituted the shutdown, the provincial shutdown with the stay-at-home order. So that took effect and then was responsible for the peaking of the curve and the steady downward trend of cases that we saw during January and February. Now, one of the things to point out is, don't forget, we started back in wave 3 at a much higher number of cases right at this point here. Look at when we started wave 2, very few cases, a much higher daily case count. And so what we're seeing here is the rather steep increase in the number of cases in wave 3. And this is where the forecast comes in. Now, this brown line is the estimated pattern of the cases that we're expecting to see between now and the end of June. But we could be in a worse situation, sort of the space between the brown line and this gray area with the dotted purple line above here. If, for example, variants of concern are more problematic, are transmitting more readily, causing more infections, etc., we could be above this brown line. If vaccinations don't arrive in sufficient numbers, if the vaccinating, if the achieving of estimated levels of coverage don't occur as quickly as we thought, we may be more in this area. So rather than a peak in mid-May of around 150 cases per day, it might be somewhat higher. These are the things that we don't know, but we assume that this is a likely direction that the pandemic is going to play. And what's going to happen, the reason that the curve will inflect and begin to go downward is largely the impact of more and more vaccines in more and more arms across Hamilton. So this is what a forecast looks like. And what we will be doing is updating this regularly and saying, as our understanding of the growth in cases, as we get a better handle on the impacts of variants of concern, as we see the impact, the growing impact of increasing numbers of vaccines in Hamiltonians, then we will see the downward trend in the cases. But the bottom line is that look at this area under the curve. We have approximately 3 months to go until towards the end of June, we could get down to a level where we step out of the gray lockdown zone in the provincial response framework and get down into the red control level, the orange restrict level, and lower levels of restrictions, et cetera, incorporated into the provincial response framework. let's have a look at what hospitalizations are projected to be. This graph here shows the total pattern of hospitalizations since the beginning of the pandemic. So you can see the pandemic, wave 1 hospitalizations, the very high daily rate of hospitalizations that we got to at the peak of wave 2. But look at what has happened in wave 3. We are projecting overall a lower peak of hospitalizations than was the case. And a lot of this reduction in the peak of hospitalizations is the result of the heavy emphasis on vaccination in the elderly populations, especially in long-term care facilities and retirement homes. So this pattern is some good news that we expect to see. And here, the cumulative hospitalizations, you can see that although the hospitalizations you can see here towards the end of June on into July, the estimation is that we were going to see a flattening of the cumulative curve of hospitalizations. And there's a very different pattern if you look at the over 70 population, because here you see the real impact of the vaccinations of the plus 70 population, especially in long-term care facilities and retirement homes. Although we had a bit of a rise in hospitalizations, there's a predicted dramatic fall in hospitalizations in the over 70s, and you can see the flattening of the cumulative curve on into the latter part of July. But look at what is projected in the 30 to 69-year-olds. This is the lower peak in wave 2, but look at the projected peak that we're anticipating will occur, reaching its maximum sometime in the middle of May, then decreasing as more and more vaccinations start to reverse and cause the downward trend in this curve. But you can see in the cumulative curve that unlike the flattening of hospitalizations in the 70 plus, there is still an increasing cumulative number of hospitalizations. And certainly our hospital colleagues will speak more to this following my presentation. I just want to go back to this slide that I just showed you to emphasize several things. It looks ominous. We've got 3 months before potentially we get down to levels of cases that will allow us to step down out of the gray lockdown into the red control zone. But remember, folks, we are not powerless in the face of this. We cannot control the spread of variants of concern, the prevalence of these more transmissible, more damaging variants. We can't control the international supply of vaccines, but there are many things that we can control. In our households, in our social and recreational space, in our daycares, in our schools, in our workplaces, in our churches, in our synagogues, in our mosques. We can all look at the environments, the policies, the behaviors that can help us through these next months realize that an end is in sight. And the more we bear down, the more we do the things that we know that we need to do on a day-to-day basis, the more that we can make sure that this curve doesn't go into this area, this gray area, but inflects downwards, perhaps more quickly than we anticipate. The other huge thing that we can do is avail ourselves of the vaccinations, get as many vaccines into as many arms as quickly as possible, because this will be the bulwark. This will be the strong, the high, the durable seawall against future waves of COVID infection in our community. So I'll stop my presentation here and turn the floor over to Melissa Farrell, the president of St. Joseph's Healthcare Hamilton.
Thank you very much. A few things that I wanted to say before I turn it over to Dr. Soth, but first off, I just wanted to make sure that I said that we really thank all of our healthcare workers, in the hospitals, but beyond in the community as well, for all of the work that they have done, but also the work that they continue to do as we make our way through wave 3, and how that you've just seen from Dr. Sider, for example. This third wave, I think it's really important for us just to emphasize how hard this is hitting the hospitals in particular. And we have spent a lot of time preparing for this. You can appreciate we've created capacity. We're vaccinating staff, of course. We've recruited more staff, but we are seeing a growth in the ICU in particular. So in some ways, that hospitalization that Dr. Sider was just showing is masking the difference between the acute hospitalization and the ICU. And we are seeing significant growth in ICU capacity. We will tell you today at St. Joe's, we're full with 31 beds, and we've actually increased that capacity over the last 6 months. And 16 out of those 31 individuals in our ICU have COVID-related illness. We've also had to ramp down surgery the last few weeks, so we have been trying our best to do whatever we possibly can to make up for that, the backlog of surgical services that we had paused last year. We were operating at about 106% by doing everything we possibly can to increase that throughput. We're back down. We've had to ramp back down to 82% of our surgical cases. So, there's big impacts that are happening within the hospital. And again, I'll get Dr. Soth to talk specifically about what those impacts have looked like on the ground in our ICU. I think just one other point that I just really want to make sure that I emphasize is that we are the regional mental health program. And I will tell you another impact that we have seen in our community is very significant increases in the referrals to our mental health outpatient services. 40% increase in urgent and emergent related cases. So we know that this is having an impact on everyone's mental health, including our healthcare workers too. So, big impact. We are as prepared as we possibly can for wave 3, but we really need the community to support us as we move forward. And this is really impacting our ICUs in ways we haven't seen so far. So over to Dr. Soth.
Thank you. So I was asked to provide some comments about the preparation work that we've done for this and what this looks like on the ground in the intensive care unit. So for those who don't know, intensive care basically means I'm a life support doctor. So I look after the sickest people in the hospital. And generally, I'm not someone you want to have to come see. It means that something's gone very wrong. So this is really where we are at this situation. We've been preparing for this type of situation for critical care since SARS. As a province, we've become much more coordinated over the last 15 years. However, the scale of this pandemic obviously is much different. We started preparing for this back in March when things first started to ramp up. We've been hiring and training people and orienting them as fast as we can. But as you can imagine, that takes a lot of time for such specialized care. We also prepared over the summer and into the fall with more physical space and more equipment to help look after people. So our usual baseline will be 23 ICU beds, plus 20 step-down beds in our hospital. We've moved up from 23 to 27 ICU beds last fall so that we could accommodate the non-COVID patients who still require our care. They haven't gone anywhere, that we still look after them. We've been trying to keep our surgical programs going. And of course, we've had this accumulating problem with COVID-19. So we're now up to 31 beds, which is into our pandemic planning level of bed coverage. So we're moving out into different areas that we had prepared. Fortunately, we do have a very coordinated department within our hospital and have a lot of support from around our hospital to do this. And the other hospitals in our region, we all collaborate well together. So we've been supporting each other as a region to look after this. I also want to say thank you to the staff that we've got who have helped to make this possible, both at the bedside and all of the support staff that have helped us to scale up in this manner. And it's an ongoing scale up. This has been going on for a year now. And, I've told you about bed numbers. You've seen lots of numbers and graphs, but this is the biggest issue here still is about people. And even though we have certain numbers of patients, the amount of effort and human resource that goes into looking after these patients is incredible. So usually we would take 2 nurses and RTs to help look after a patient in the ICU. It takes 5 to 6 people to safely turn one of these patients without dislodging their breathing tube. And, we would often have a few patients like that are that sick in the ICU. Now we have in the multiple teens, over half the ICU is like that. So the workload, even though our bed numbers have gone up, the workload has gone up much, much more than that. And it's not just the work of doing that, it's the work of doing that over a sustained period of time. You have to do this while wearing infection control gear, which is very difficult for people. And you have to do this in a compassionate way, both for the patients that we're looking after and for their families. And anybody who's looked after or been involved with someone who's critically ill knows that this is a major illness that affects not just the patient in the bed, but everyone around them. And it's very difficult for our patients and their families to be separated due to infection control needs that we have in this situation, even though it's necessary and we have no choice. And of course, the people at the bedside who actually really care about what's going on with this, it affects them as well, because we hate to see this happening. And it's very emotionally draining. And, you know, our job's always been emotionally draining, but the thing with COVID-19 is it's become so pervasive in our society right now that we look after this in the hospital and then we go home and it's still there. So, you know, we have our families with our kids, families, friends, neighbors, all who have been dealing with the stresses of all the social isolation and job insecurity and general uncertainty that's been weighing on all of us. So it's been a long road for people with that. And we are as prepared as we can be to deal with this. However, the thing that's concerning with this wave to me is that we're seeing a different patient population. In the first wave, yes, the hospitalizations were high. However, a lot of those patients, you know, were looked after on the wards. And we're now getting into a younger population who is both younger and sicker with these variants of concern. And we do have more options for treatment, but the mortality for people who end up in the ICU is still about 1 in 3. So it's quite significant. So, you know, this concerns me that we're seeing more of these and we still are into the third wave. We're not through it. The issue is that by the time they get sick to the point of requiring the ICU, that's usually a couple of weeks after they've gotten an infection. So even if people stop getting infected today, we won't see the peak of this for a couple of weeks from now. So that's why it's concerning that we see the trajectory going up right across the province very dramatically. And it's not just little pockets here and there where we can transfer people between hospitals, it's everywhere. So this is going to be a big issue for us. So I'm now going to pass it over to Rob McIsaac, who's the President and CEO of HHSE for more commentary.
Thanks very much, Dr. Soth. So I want to spend a bit of time talking about our region and what is happening with the pandemic. I'm sure many of you are aware that provincially, I expect we will have exceeded over 500 COVID-related critical care patients, with 46 new patients in just the last 24 hours. COVID ICU admissions continue to climb rapidly across the province, but nowhere more so than our neighbors to the east, where nearly 40% of all new admissions to the ICU and central region are now COVID related. More locally, HNHBB has 58 critical care ICU COVID related patients and 88 COVID positive ward patients. That represents, as Melissa was saying, up to 90% of the ICU occupancy for some of our partners in the region. Joseph Brant, the General, Juravinski, St. Joe's, and Niagara Health have all received Toronto critical care patients over the weekend. It's worth noting that London Health Sciences has also been accepting patients from the Toronto region, and we expect more patients will be arriving throughout this week. While we continue to have additional capacity, there's no doubt our system is becoming very pressured, and it is daunting to consider the coming weeks, as was depicted in the modeling. We can expect that HNHBB hospitals will be reducing surgeries requiring ICU, and that staff from other areas will be redeployed to support those high occupancy levels within our ICUs. We have created a pandemic response effort for hospitals across the region. So people should know the CEOs of all of those hospitals are meeting weekly. And we've stood up committees of key staff and physicians who meet on a daily basis to try to load level the pressures across the region. Our clinical leaders monitor our capacity on a daily, even an hourly basis. I should also know that HHS is now proceeding to stand up one of 2 provincial mobile health units. The other MHU is being set up by Sunnybrook Health Sciences Center in Toronto. The Hamilton-based MHU will house 80 hospital beds and serve as a provincial resource to accommodate extreme pressures on the healthcare system. We expect the unit will be ready for patients next month. It's being set up in the footprint of the parking lot on Wellington Street, and this space was selected because of its proximity to HHS facilities, particularly the Hamilton General Hospital. As you can tell from this update, this is a very dynamic situation. We're very concerned by the trajectory of the current numbers, but I should emphasize that this is a future which can be changed, and the community has an important part to play. Follow public health measures and get vaccinated as soon as you can. Like Melissa, I want to thank all of our hospital workers for all that they continue to do. I'm very proud of them. I'm now going to turn things over to Dr. Sharma, who is a neurosurgeon, an intensivist, and site chief at HHS. Sanjay.
Thanks, Rob. So I'm going to just carry on a bit about the regional plan and how the ICUs across the region have been working together. And as everyone's kind of highlighted, we do continue to work together and monitor and manage our ICU capacity. And to that point, the medical leads for all the regional hospitals for critical care communicate every morning about our capacity to care for COVID patients and how to best kind of utilize our resources for coordinated response to this entire pandemic. So we speak every morning, and while doing that, we've actually found that the capacity in all our ICUs every day is shrinking. Recently at the Hamilton General, we're seeing more patients overall, both with COVID and for other regional programs served at Hamilton General, such as trauma and neurosurgery, all patients requiring critical care. So while Hamilton and the region have been an outlet for Toronto to help the overwhelming situation there, this outlet valve is slowly becoming more and more limited due to COVID, especially the variants, and seeing younger and younger patients, but also with our own regional pressures, including the demand for ECMO, which is many people will know as the heart-lung machine, which is a last resort that can be used in COVID and is offered for this entire region at the Hamilton General. So as mentioned before, our ICUs are becoming more and more challenged in the region with up to a 90% occupancy. And this is actually even more so for Hamilton Health Sciences and St. Joe's, while we're working to preserve our surge capacity and maintain our regional responsibilities at both hospitals. But as Rob pointed out, the situation's getting worse, with Toronto region having 40% of their new admissions to ICU COVID related. So just to provide context, we've accommodated in the region about 73 patients from out of the region, all of them from the Toronto area, as part of the province's load leveling strategy. But to put a fine point on it, over the last 4 days, we've taken 10 patients into this region from the Toronto area. So in this situation with increasing critical care bed demands, we're hoping to avoid further emergency measures, which include providing healthcare in unconventional spaces or deferring more care, as all of our organizations worry about every single patient that we interact with. To help, we've been granted some temporary ICU bed funding in the interim and have opened up some pandemic beds both at the Juravinski and at St. Joe's. But I think it's important to know, and this builds on what some of the other folks said, that adding a bed isn't just about adding a bed. It's about the whole team that supports the care for the patients that need those beds. It's about specific skill sets and expertise that's necessary for that care. And we do have remarkable teams both at Hamilton Health Sciences and at St. Joe's and all our regional partners. But more than a year into the pandemic, it's starting to take a toll on everyone, and the wear is starting to show. So we encourage individuals to seek the care they need when they need it and keep appointments for regular care and diagnostics to ensure that whether COVID or not, that their health care is the primary concern and they access care when they need it. From a hospital point of view, we'll continue to work with our partners to manage critical care capacity. And we know it will take all of us, including the community, doing our part to support care and manage through this pandemic. And then finally, I just wanted to thank our staff and physicians for the tireless work that they've done to protect and help our community. And I can't emphasize enough how hard everybody's been working at all the hospitals and outside of the hospitals to help our community navigate through this. And I think they all deserve a gratitude of thanks.
Great. Thank you, Dr. Sharma, and thank you to all of our guests today. So we are going to go directly to media questions now. We have 9 media joining us today. So as usual, we'll ask you to stick to one question and one follow-up. And for today, if you can direct your question to just one of our spokespeople, that would be wonderful. We'll start with Nicole Martin from CHCH. Nicole, you can go ahead.
Thanks for taking my question. This is for Dr. Richardson. So we do know, and as you mentioned, that the province is opening up to certain postal codes for 50 and older to get a vaccine. In Hamilton, there are 2 postal codes. Both are on the mountain. They do not include the lower city. The province has clearly said today that it's up to local public health units to adapt for their communities. We're seeing right now that York Region has 5 postal codes, and they're even lowering the age to 45 to 59 in those hot zones. So how will Hamilton be making any changes, and when will those people 50 and older be able to get their shot?
Thanks very much, Nicole. And, very important to move forward with this. And we're very pleased that we're going to have the booking tool, because that's a huge piece for us in terms of being able to get people going with this approach, because trying to put together alternate ways of making lists or any of that sort of piece is a very significant challenge. We've been on the phone today with the province asking that they add some additional areas to the booking tool. We're just working through with them what those might be based on our local analysis, which would include areas in the lower city. So we're very much working on that. We're hoping they're going to be able to make those transitions soon. We don't have the timelines yet from them in terms of when that will go forward.
Okay, my next question is also for you, Dr. Richardson. As of April 2nd, that was when Toronto, Peel, and York began booking appointments for 60 plus in their region. And those are 3 areas that are also using the provincial portal. We did receive a statement yesterday from Public Health talking about they couldn't lower the age limit because it's up to the province. The Solicitor General told CHCH today that when they learned the lack of appointments at First Ontario Centre being booked, they made this change. So I just want to know, when exactly did you ask the province or make the request to adjust the age group here?
Thanks very much, Nicole. So we've been in dialogue with them about when adjustments were going to be made, and it understood where their schedule was at. And as we looked at the appointment situation, we asked yesterday for ours to be dropped lower earlier rather than waiting for the province to go forward with their change. This was when we became aware that they'd be willing to make that change, and we asked right away that happened.
Thanks, Dr. Richardson. Our next question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. This would be for Dr. Richardson. We've obviously seen other regions have made the move to close schools to in-person learning due to an increase in cases. And we heard from the Manny Figueredo, the director of Hamilton's Public Board this morning. He's concerned about basically the rise in cases after the spring break. So are you considering requiring schools in Hamilton to move to fully remote learning after the break if you do continue to see a rise in cases?
Hi, Lisa. So this is a very active discussion that we're in right now with the school boards. We've heard from our pediatric experts, our Children's Health Coalition here in Ontario. If you haven't seen their statement, it's a great statement about the importance of our schools to the learning for our children and the effects that happen when you close the schools as well. So this isn't just a COVID-19 decision. This is a decision about what impacts do they have on schools, particularly or on kids, particularly in those families that are also being disproportionately impacted by this entire situation. And so we're trying to respect both sides of that balance as we go forward, make sure that people could be prepared if we were to look at closing it down. And so we'll continue to have those discussions as we look at the numbers over the next couple of days.
Okay, thanks. So, and this is just kind of a follow-up on that. Niagara's public and Catholic boards are looking to vaccinate employees in schools to kind of prevent the closures. So is that something that Hamilton's Public Board or Hamilton Public Health is looking at doing with the staff in Hamilton schools?
Thanks, Lisa. So there's a lot of active discussion about how we move forward with our phase 2 populations. As you know, the province has identified Hamilton as a hotspot. So definitely we want to get out and vaccinate people who are 50 plus who are in those particular hotspot areas. We're hopeful that'll get to a number of essential workers who are out there and working right now. We're also looking at moving forward with our highest risk populations from a health perspective. You'll know that there are a number of groups that are on that list that need to be vaccinated vaccinated. So we're working with Rob and Melissa here and all of our hospital partners and healthcare partners about how can that move forward. And then we're looking to at how we go beyond that. So there are many populations here in Hamilton that we want to do. Teachers are a part of that group as we move forward. And it's a matter of looking at the vaccine supply we have coming in and how do we best sequence to minimize the impacts on all of our population.
Thanks, Dr. Richardson. Our next question will be to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone enjoyed the long weekend or caught a breath in there. My first question, I guess, is for Mr. Rob McIsaac. I understand that St. Joe's is moving forward with an ICU surge plan, and I just wonder if HHS is doing the same thing, because I realize you tend to be pretty coordinated.
Yeah, a good question. And absolutely, both HHS and St. Joe's are moving forward with those surge plans, not only internally, but also coordinating with each other and across the whole of the region.
Okay, thanks. And I'm sorry, maybe I'm going to break the rules here. I don't have any specific healthcare expert to refer this question to, but we've just seen over the weekend, like Dr. Michael Warner and others have been sharing some patient stories to drive home that there are human beings behind these numbers that we're talking about. And I'm wondering if someone on this call today can just share any real patient cases that you've seen that resonate with you.
Yeah, I'm going to suggest either Dr. Sharma or Dr. Soth might be in the best position to answer that.
I can provide some general cases, but I can't give any details, obvious for confidentiality reasons. But some of the things that we've seen, we were trying to level the care of patients across the province and moving people around the best that we can. However, I think that comes at a lot of difficulty for the people that are getting moved around. So we've had people who have one family member sick here in our city, another family member sick in another city, and they have to try to go between those two areas where they're critically ill and their relatives, may well die from it. So this is extremely difficult for people who are trying to be there for their family members, yet there's all these restrictions, and we're trying as a system to look after everybody that we can, but it's difficult on an individual level.
Yeah, I would just echo what Dr. Soth said. I was myself involved in a patient where the family was split across 3 different ICUs across the province, and it's emotionally very draining for the staff, but more than that, it's very emotionally draining for the team, the family looking after 3 patients who are critically ill. And so those stories are challenging. And so, obviously we have to do the best as a system, but those individual patient stories are difficult to experience.
I also think it's difficult to comment about that on live TV because a lot of these patients hit very close to home to us. So, we see people our own age, we see people that are our parents, we see people that look just like our friends, and they're in the ICU dying from this. So it's not something we can talk about easily.
Thanks, everyone. We'll go next to Don Mitchell from CHML. Don, you can go ahead.
Sorry, my mute button is sticky. Thanks very much for taking my question. I think this would be directed more to the St. Joe's staff, and you have an ICU surge plan that's going ahead. I'm wondering if you can kind of give me a little more detail on what that's going to mean for staff in terms of what your setup will be.
Well, the staff that we have looking after patients in the ICU are largely the same staff that do already. We do have a lot of staff that work in other areas of the hospital that have similar skill sets. So we've been making good use of having them come in to help us. Our nurses and physicians, everybody's there helping mentor people along to work as a team. The ICU has always been a team environment. So really it's not that big of a stretch for us to have staff functioning as a team there. So all it means is that we're bringing in some other people and integrating them in. We've been trying to do this in a proactive fashion. So when we are hitting thresholds, we're having to bring in more help, we try to do that in a controlled way so that we can acclimatize people before it gets really even more hectic and they have to continue in that. So this is something that we've been operationalizing this for a long time now, and it's just as we start to get one level of need being hit, we try to stay one trench ahead in planning for the next level, which includes the staff that are working with us. Now that includes, that's the staff working in the ICU, but it's also the staff in the other areas of the hospital. So our medical wards are integrated with what we're doing and the discussions that they have with their patients. The surgical program is constantly looking at the numbers of people that we can put through as cases and look after properly. And the emergency department, of course, is another variable. So we're quite used to managing all of these different competing interests on a day-to-day basis. That's nothing new. It's just that this is a bit of a higher level and it's a longer sustained surge than it has been in the past.
Okay, we'll go next to Maria from the Hamilton Spectator. Maria, you can go ahead.
Thank you so much for taking my questions. My question is for Dr. Richardson. In light of the sobering projections from the doctors and the comments about hospitalizations in the third wave, I was wondering if you can shed light on why so few appointments were being booked at Hamilton Health Sciences and the First Ontario Centre over the weekend and yesterday. And I know that the eligible age group expanded from today, but we haven't yet finished vaccinating those who were eligible from before. So I was wondering if you can just shed light on that and, the fact that we have vaccine, we have capacity, but why we still don't have injections getting to people.
Thanks very much, Maria. And absolutely, as we go forward, and you've heard from the mayor, you've heard from others here today, that getting vaccinated as soon as you can is a really important part as we move forward. So whether you're open to getting vaccinated with AstraZeneca and are 55 plus and can get that from your local pharmacy, or whether you're in the eligible age groups or eligible areas now and are able to get that through First Ontario Centre or St. Joe's, moving forward with vaccine as soon as you can is very important. Vaccination is a very personal decision. Some people make that decision quite quickly. They've been thinking about it. They know they want it. Some will be a little bit slower in terms of making that decision and deciding to go forward. So we're very much encouraging people, reach out, talk with people about it, go to trusted sources of information and come in and get vaccinated. We're sitting right now at about 80% of those 85 plus 85 and up that are vaccinated, about 77% of those 80 to 84, about 69% of those 75 to 79, 60% of those 70 to 74. And then as we've just begun to move down into those lower age groups, of course, we just have some lower numbers that are vaccinated in those groups. So we are making very good progress. We want to make more progress. We want to make this available to as many people as we can as we go forward.
Thank you very much. And I wonder if you can just confirm that whether there were any booking issues that were also a factor in this, as well as for the appointments that went unfilled, how many doses were left over and what was done with them?
Thanks, Maria. So it's important to remember when we take the vaccine out for the day, when the staff who are doing this do that, they take out as much as they think they're going to need for that day. So it's not based on the number of appointments, but based on the number of people who are booked in that day. It's very carefully managed by Hamilton Health Sciences, by ourselves in public health, by St. Joe's, by anybody who's using it. They know this is the gold essentially that they're handling. And so they're very, very careful about it. And they thaw as much as they need and then utilize those doses as they go to absolutely minimize any sort of wastage. So that vaccine would be held for the next day's appointments and continue to go forward and be utilized as we go forward. Maria, there was a second piece to it. Oh, booking systems. And were there any issues with it? No, we had no issues with the booking system over the course of the weekend.
Thanks, Dr. Richardson. We'll go next to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Hi, folks. Thanks for taking my questions. My question is also for Dr. Richardson or perhaps for Mayor Fred Eisenberger. So I wanted to double back and ask about the province's list of hotspots. And there was only a couple in Hamilton. And I'm wondering how restrictive or appropriate you think this is just for the 2 postal codes in Hamilton to be included among 90 or so others.
So thanks, Christine. I think, we're looking at the methods that they use to determine who it was that were in those hot spots. And in fact, Dr. Sider can speak to this better in some ways than I can. But essentially, they used a review of hospitalizations and deaths that had happened over the course of the pandemic. So that would very much focus in on groups that are older, as you've just heard about from Dr. Sider, around what we saw in wave 2 versus what we're seeing in wave 3. It would focus in more on populations that are older, and many of those populations have already been vaccinated, as you just heard about. So what we're looking at is looking at more what we're seeing now as we go forward, and what fits more with this particular wave, and negotiating with the province about how they could be, the people in those hotspot areas could be vaccinated.
And Christine, if you'd like a follow-up, you can go ahead.
Sure, thank you very much. And I did want to ask about vaccinations, because it's clear, that it's going to have a huge impact as seen on that forecast chart for the cases. And so I want to ask, perhaps again, Dr. Richardson, what needs to change aside from community outreach to ensure that people keep showing up and that the turnout continues to climb?
So I think there's a few things that we've been working on. We're working on getting out into the community so it's very accessible to people. We've had as well transit that's been available to people to help get them to the clinics, should that be helpful. We know that talking with people that have been part of the vaccination program is really important, especially in our racialized communities, having our vaccine ambassadors talking about the vaccine and encouraging people to utilize it. So there's a number of different tactics that we're using to get those vaccination rates up, but we especially just want to make that vaccine available to as many people as we can as we go forward and have supply.
Thanks, Dr. Richardson. Next, we'll go to Sebastian Braun from the Hamilton Spectator. Sebastian, you can go ahead.
Hi, thanks so much for taking my questions. I know it's kind of been touched over so far in the briefing, but Dr. Richardson, I was hoping you could clarify how the province can identify those two postal codes, LAW and L9C, as hotspots, because I'm kind of puzzled by it. Data from ICES, the Ontario Research Institute, shows there were 15 other postal codes in Hamilton that had higher test positivity rates than LAW in the month of March. 11 other postal codes had higher test positivity rates than L9C. Can you explain that discrepancy? Did you explain to the province that there were other postal codes with higher?
Thanks, Sebastian. Yes, we've been noting back with the province about what our analysis shows. We've shared with them our analysis and what it is we've taken into account, which is those things that you're talking about, test positivity, as well as the degree to which people are actually getting tested, because we know just getting tested has in many communities been a barrier. So those have come in, as well as our case rates and those sorts of things. So we're talking through with them what our methodology is and what we're recommending as we go forward.
Okay. And phase 2 of the vaccine rollout includes those with highest risk health conditions. Can you explain how they can get their vaccine appointments in Hamilton? Do they need to just book online? Do they have to talk to their doctor? Or?
So we are seeing across the province, we're seeing that getting vaccinated through people's doctors, through their hospital clinics, those sorts of things are probably the way that this will move forward. Remembering for this group of people, often it's a very important conversation to have with their treating physician about what is going on for them. So you'll know that, for example, blood cancers are one of the conditions that's at the highest level of risk. So people have to be quite careful about when they might get vaccinated in relative to the course of their treatment. So their specialist knows best how to do that. So in fact, we're going to be working that through in the coming hours, actually, to talk about how do we move this forward. We have some plans that are just about ready to go, and others that we're still working through.
Thanks, Dr. Richardson. Our next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My first question, I think, is for Dr. Sider. The forecast for hospitalizations that are lower than the second wave is opposite what the COVID science table predicted on Thursday, which is like an unprecedented number of COVID patients in ICU as the variants make younger and healthier people severely ill. Do these projections take into account how the variants are hitting young people? And can you talk a bit about why, or is it something about Hamilton, like why we're seeing that discrepancy and what is right for Hamilton?
Thanks for the question. Don't forget, the science table is looking at the provincial picture. Okay, and that provincial picture is really driven by several very high incidence jurisdictions, especially Toronto, Peel, York, etc. And so what we have the opportunity and why we've established the partnership collaboration with SCARSN is that we want to look at the Hamilton data, we want to look at the Hamilton patterns of hospitalization. We want to look at our particular age demographics. We want to look at how effective, how we're playing out vaccines, because one of the vital bulwarks against the growing threat to the hospitals through the variants is the degree to which we play it out. So probably some of the differences are due to the fact that the science table is looking at a broad provincial picture driven by several of the high prevalence, high incidence communities. We're looking at, the Hamilton specific. And there are other factors as well that you have to recognize. And some of our clinical colleagues have spoken to that when you look at the pressure on the hospitals, et cetera, it's not just the demands that are occurring from infections that are occurring in Hamilton residents, et cetera, with regional load sharing, et cetera. If you've got ICU capacity, oftentimes there's transfers from other communities to utilize that capacity, which puts tremendous pressure on our hospitals, but is not necessarily reflected in the hospitalization pressure that's generated from COVID transmission here within Hamilton.
Thanks very much. And my next question would be to someone from the hospitals. I'm not sure who would be best to answer this, but the science table on Thursday, they talked about a very alarming situation where there is potential for the healthcare system to be overwhelmed. Similar, they referenced Northern Italy and New York, and this was very soon, like within weeks. So, what are we facing here in Hamilton? Like, are our hospitals going to be overwhelmed within a matter of weeks? Like, will we have to bring in the triage protocols? Like, what can we expect here in Hamilton?
So I can at least start to answer that question. We are, the occupancy at our adult sites is already close to, if not at 100%. Both hospitals and all the hospitals in our region are trying to come up with ways to increase our immediate critical care capacity, so we don't have to go down the road of more kind of striking measures. So we are working internally and across sites to upscale our critical care capacity beyond what we have, and figuring out staffing models and extra beds that we can utilize to hopefully accommodate the increased number of patients that we anticipate coming.
Yeah, I think, Joanna, I think that's a possible future, but it's one that we're working hard to avoid. And it's, the comments I was making at the end were really, look, that's we have an ability to shape the future. The community has a big role to play. All of us have a big role to play in terms of our preparedness and planning. We are desperately working to avoid that very situation that you're referring to.
Great, thank you. Our next question will be to Voisa from the Hamilton Spectator. Voisa, you can go ahead.
Thanks for taking my question. This one's for Dr. Richardson. There's 1 greenhouse and 2 plant nurseries on the outbreak list right now. Conan Nurseries in Waterdown has 25 staff cases, and they're currently the highest number of infections in a non-hospital setting. Can you tell us a bit more about this outbreak, whether you're investigating if they complied with public health advice, and if there will be any enforcement action?
Thanks very much, Voice. Yes, both of these outbreaks are very much under active investigation. I will say, in our working this through, they've been very thoughtfully managed by the management, these 2 businesses, in terms of the way they're organizing their work. And this is a good example of how, you have to follow measures very, very strictly, because just the small things that you don't realize that you're doing can end up leading to transmission of COVID-19, and why we need this, as much as possible to have people staying at home, not going out, doing all the sorts of things that we're talking about that are necessary, whether or not the province has brought in a broader order. So we are continuing to work with them, looking at what further measures might be necessary in terms of bringing this quickly under control. We are, of course, quite concerned with this having involved our temporary farm worker population, who we know as another vulnerable group that we're dealing with, and we know the connections that can happen across that population. So very much an actively monitored and managed situation.
Thank you. And my follow-up is also for you. The Premier said today that the province plans to vaccinate high priority essential workers in hotspots, and he pointed to the manufacturing sector. Are any of these settings in Hamilton, or are you recommending any Hamilton manufacturers to the province, and if so, which ones?
Thanks, Voya. This is a group that we haven't entertained at present. We're certainly looking at all of our essential workers, but haven't gotten into specific subgroups other than the ones that we've discussed so far.
Thanks, Dr. Richardson. I missed Don Mitchell's follow-up question earlier, so we'll go back to Don for your follow-up question. Go ahead, Don.
Yeah, my follow-up question was actually, I may cheat a bit here, is to the hospitals in terms of scheduled surgeries. And I just wanted to know, because obviously in the first wave, a lot of that had to be postponed. Do we think that any of that potentially is happening in the near future?
You mean in terms of deferring more surgery?
Correct.
Yes. So as I was mentioning earlier, we had been trying to catch up and had, at St. Joe's in particular, and I know Rob will talk about this specifically for Hamilton Health Sciences, but we had been trying to catch up. We had been running at about 106%, and we're back down to 82%. We might even have to go lower, and that's largely for a few reasons, but one of them, of course, would be for us to be redirecting the staff towards the rest of the surge plan. So those are, they're highly skilled staff who work in the surgical areas that often are the ones that are the best for us to be redeploying into the ICU if necessary. So unfortunately, given the circumstances, this is part of what's happening. We're doing everything we possibly can to do same-day surgery, obviously keeping up anything that would be considered urgent and emergent, but we're quite worried about what the next, few weeks are going to bring in terms of what that surgical workload will look like. We monitor it, as was mentioned, Dr. Sharma was talking about that, and so was Rob. This is monitored every single day, and it's actually monitored at the regional level too. We're trying to do everything we possibly can to keep as much as we can going, but it's certainly having an impact, and it's not just at St. Joe's, it's across the region right now. Rob, did you want to make a comment?
Yeah, I would say HHS is in a very similar situation. We are at about 84% of our pre-COVID activity levels in terms of surgery. So, that 16% in theory reveals the amount of surgery that we're not able to get at that we would have gotten at were it not for COVID. So I think Melissa is right. We are doing all that we can to maintain what we're currently maintaining. We're also having an eye to the future to think about how we will catch up when the pandemic ends. We've stood up a regional committee of chiefs of surgery from across HNHBV to be working together in collaboration to try to optimize the levels of surgery that are being done across the region. Finding opportunities to get through wait lists and so on as we move forward. So It's something that we're very concerned about and that we're actively trying to plan against.
Okay, with that, Mr. Mayor, that's the end of our media questions for today. So I will pass things back to you for some closing remarks.
Thank you, Jasmine, and a special thank you to our guests today, Dr. Sider, CEO Melissa Farrell, Dr. Soth, Rob McIsaac at Hamilton Health Sciences, and Dr. Sharma. Thank you so very much for your leadership through this process and sharing this information with us today. And I am filled with appreciation and gratitude to the high level of commitment all of our healthcare workers are maintaining through this very, very difficult, long, enduring challenge. And I can only imagine how much of a personal commitment it takes to actually maintain our healthcare system and the health of our citizens in our community, and the personal toll on all of them. So please, share our gratitude and thanks for all the work that they're doing. And we're also grateful for Bill Custers and the entire team here at Cable 14 and Clear Cable for helping us put these advisories together. Thank you all for your good effort. And of course, to our media partners who we rely on to share all the information that we've shared today or with the broader community. So it's very important that people get accurate information, and they can do that as well by going to accurate information sources like the City of Hamilton website, the covid19.ca/coronavirus website, and for vaccine information or for financial fiscal issues that are available to those that are challenged in our community. Everything related to COVID is on our website, and certainly I would recommend the provincial website as well for accurate information around vaccines and all the questions and frequently asked questions about what vaccines, testing, and everything that's gone into getting them to us today, and being able to vaccinate as many people as we can as quickly as we can. So we're working awfully hard to do that. We are ready to continue to vaccinate folks in our community in various ways. And what we need is more supply. And when that supply arrives, we're ready to bring it to folks in our community to ensure that vaccinations happen to everyone that wants one. And I continue to encourage people that have not yet booked an appointment that are 65 plus. I encourage you to do so, or for family members that can talk to your family and friends, impress upon them or share with them good information sources to impress upon them the value and the importance of getting vaccinated to our broader community. It's a commitment to our entire community that people get a vaccination. That, I think, is what good neighbors do. And hopefully everyone that's eligible will take the time to get vaccinated sooner rather than later. So continue to do all the public health measures as much as you can. You are making a difference in terms of stopping and spreading the virus. We need more of that to happen in the coming days and weeks. And in the meantime, we are going to come back here on April the 12th at 3 p.m. and we'll provide another media update at this point in time. Thank you for joining us, and stay well, look after one another, be kind, and be patient. Thank you.